My name is Blair Kosrich, and I'm the 3D Printing and Training Center Administrator here at Clarkson College. We are outside of a hospital facility. We can do 3D printing for outside clients, physicians, and hospitals. Also, we can use it for our education side of things in helping teach our subspecialties here at Clarkson College. In our field, we're finding every day that there are people that just don't know how to do 3D visualization, also 3D printing. So we came together and formed a 3D printing certificate. You can finish it as little as a semester. It's all online, so it's super affordable and easy for our students to go through. It's designed to give them hands-on experience with the software that we're using, as well as knowing how to set up a print on the printer. Being able to give the students a realistic anatomy model to simulate realistic procedures before they go out into clinical. That's huge for Clarkson College, to be able to provide something that no one else can provide their students. I wanted the digital anatomy printer because I've seen and held the prints, and I knew that this was the next big thing. This is how I could enhance patient care and education. I would recommend the digital anatomy printer because of the endless possibilities. Being able to print in anatomy form that's realistic to the touch and feel, and have realistic color mapping on models too. The printer can do it all versus having several printers in your print room. Particularly with the digital anatomy printer, I foresee it growing and just being able to then provide even a higher level of prints that are more detailed. Those things I think are only going to enhance patient care, but also I think it's going to lead into a whole nother world of 3D printing. I've had surgeons tell me that they've completely changed their course of what they're going to do for surgical intervention based on what they're seeing and how they've practiced it on the model prior to the procedure. And I think that's super important for not only the patient education side, but also the physician education side. For a patient to be able to touch and feel a model to see exactly what it is they're going through, I think is the ultimate patient consent. And I think physicians will have a better understanding on how they can convey a diagnosis to their patient. Our mission is providing a language that anyone can understand, and 3D printing is just that.